Hey everyone, it's Craig again, here for another episode of One Man's Cancer Journey. Today, not so much of an update, just a little bit more of a rant on our healthcare system. So again, trying to be open and honest about the feelings that I'm going through as I'm going through this experience. So I'm going to talk about three particular areas in healthcare that are kind of frustrating me right now. The first area is the bureaucracy that we see with our insurance companies. So what I've learned is that while I have insurance, it's not actually the insurance company that's approving or denying my claims. They actually farm it out to a third party, which extends the time needed. And where this has been frustrating is on Tuesday of this week, I actually had my port implanted, and the port is a device that's implanted in my chest that allows them to deliver the chemotherapy and immunotherapy directly into my veins. And so where I've struggled with is that while I have been approved for the port, I haven't been approved for the chemotherapy. And so here we are a week later waiting for the insurance company to approve my chemotherapy so that I can actually start my treatment. And it just seems a little ridiculous. So they've acknowledged that I have cancer. They've acknowledged that I had the need for the port and approved that, but they haven't approved the actual chemo treatment that's going to help to fight and combat this cancer. So it's very frustrating. The second area that's causing some frustration around is the cost. Just the cost of our healthcare in the United States is ridiculous. I've been relatively healthy my whole life, so we are on a high deductible plan, and I acknowledge that I chose that and I accept that. But what's frustrating is I have to pay so much out of pocket before to hit my deductible, and then I get a co-insurance, and then I have to pay quite a bit more as well until the insurance starts to cover it all. And that works okay because I've now hit that second level, but what happens is the plan year ends and I have to start all over again. And unfortunately for us, the plan year is ending right in the middle of my disease. So while I have hit the numbers for this year, my new plan year starts in October 1st. And so now I'm going to start all over and have a bunch of out-of-pocket expenses to get me back to where the insurance is copaying. And the third and final area that I wanted to hit on is really just the challenge that we have with our government. We have a two-party system for all intents and purposes, and they both seem to be on the extreme and really not wanting to work together. And the only people that really makes suffer is us, the citizens of the United States. We have senators and representatives who have great pension plans and who have great lifetime health care, much better than the average American. And they're the ones making the decisions. They're the ones that are taking money from lobbyists at pharmaceutical companies for their campaigns, for re-election, but not really doing things to help advance and get things under control. Now, I know that pharmaceutical companies, they invest a lot of money into developing these drugs, but they are all very profitable as well if you follow them on the S&P 500. And so when are we going to start challenging them to start pouring some of their profits back into making healthcare more affordable? They sell some of these same drugs overseas at much discounted rates, but we don't seem to have that same issue here in the United States. We just have to pay the costs. And so it's really frustrating that we just don't seem to be making progress. And if we truly look at it, our pharmaceuticals that we have, they've come very far. We have some great advances, but they're really more about maintaining life, not about curing diseases. And if we look at how many diseases we've actually cured with the billions and billions of dollars we've poured into pharmaceuticals, it's very small. And so it's very frustrating to try to understand why, when we're putting so much investment in, we can't begin to see some results. And I know there's lots of different reasons, but it just feels like we should be making greater advancements. And, whether you agree with the vaccine for COVID-19 or not, one thing that did happen is we had multiple pharmaceutical companies coming together to share data and work together to develop something. And I just wonder if that model isn't something that we should be looking forward to going forward. So I'll kind of get off my high horse of ranting, but I just wanted to share those frustrations. But I will say on my moment of gratitude is I am very grateful that I do have insurance. I know there's many Americans that don't have or who have less coverage than I do. So I am grateful for the fact that I work for a company that does provide me with insurance, and that the insurance is helping to offset the enormous costs of fighting this disease. Because without it, I can certainly see how people can get far in debt. My family got out of debt in 2009, and we never want to go back. And I'm praying that what we're going through here does not take us into a point where that happens. I'm praying that the others who are going through this also have the opportunity to use insurance, and it doesn't drive people to bankruptcy, because we really shouldn't. We should be taking care of one another, caring for one another, and helping each other get better, and not putting them in worse positions just because they got diagnosed with a disease. So I am grateful for the insurance companies and the pharmaceutical companies, but I just think that there is opportunity for us to really evaluate our systems and look at things a little bit differently, and maybe get a little better at what we do. So thank you for listening to my rant today, a little less of an update and a little more of a rant. But again, just trying to be open and transparent with the thoughts and emotions that I'm going through as I go through this cancer journey. So thank you once again for joining me on One Man's Cancer Journey.